Talking about the Miller-Fisher syndrome. What is Miller-Fisher syndrome? The Miller-Fisher syndrome, there is repeat ataxia. In the Miller-Fisher syndrome, there is repeat ataxia. There is gait disturbance. Repeat ataxia. Areflexia without weakness occur in the Miller-Fisher syndrome. In the Miller-Fisher syndrome, areflexia, loss of reflexes occur, but this reflexes is without weakness. In the Miller-Fisher syndrome. The Miller-Fisher syndrome, ophthalmoplegia with pupillary paralysis occur. Ophthalmoplegia in the Miller-Fisher syndrome occur. Ophthalmoplegia are developed in the Miller-Fisher syndrome with pupillary paralysis. There is pupillary muscle paralysis. There is pupillary paralysis. The Miller-Fisher syndrome accounts for 5% of the cases of the GBS. Miller-Fisher syndrome occurs 5% of all cases of GBS, Guillain-Barré syndrome. The Miller-Fisher syndrome is strongly associated with antibodies to gangliosides. In the Miller-Fisher syndrome, autoantibodies are formed against the gangliosides. This against the gangliosides, GQ1B. These autoantibodies are formed in the Miller-Fisher syndrome against the GQ1B. In the GQ1B, the autoantibodies are formed against the GQ1B in the Miller-Fisher syndrome. And Miller-Fisher syndrome occurs in 5% of all cases of the GBS. But in the Miller-Fisher syndrome, there is repeat ataxia, gait disturbance, gait disorders, areflexia, loss of reflexes without weakness of the muscles. But the ophthalmoplegia, pupillary paralysis occur. And 5% of cases of the GBS, there is Miller-Fisher syndrome. The Miller-Fisher syndrome is autoimmune disease in which the autoantibodies are formed against the gangliosides of GQ1B. Autoantibodies are formed against the ganglioside GQ1B.